Hello everyone, I'm Jay Maraclan and today I'm going to perform Leopold'S maneuver return demonstration. Leopold'S maneuver is to systematically palpate the gravid uterus. The maneuver is standard palpation of the abdomen for assessing the fetal position. The presentation and engagement of the fetus inside of the uterus. Prior to the conduct of the procedure, I had to prepare the equipment needed to conserve time and energy. And this includes the towel, pillow, and the stethoscope. And also, I am going to perform hand washing to deter the spread of microorganisms. Good morning, ma'am. I am Jay Maraclan, your student nurse for today. May I see your wrist number? Okay, thank you. So for today, I am going to perform the Leopold'S maneuver. We'll be doing to expose your abdominal area and palpate and trying to determine the position of your baby in the uterus. So this procedure is important because this will help you and your healthcare providers is well to prepare for your labor. And also I already closed the door and so that no one from the outside will be able to disturb you while you're doing the assessment. So you don't have any question and clarification. So before we proceed, I will encourage you to avoid first. We encourage the patient to avoid because an empty bladder promotes a comfort and allows for a more productive examination. So, since you've done voiding, please stay back down and slightly flex your knees. So position the patient on supine position with 1 pillow under her head and with knees slightly fixed. So ma'am, I'm going to fix the towel beneath your hips. Next, stand on the patient right side. If right-handed, face the patient for this is done so that in the third maneuver, it is easier to grasp the symphysis pubis. Ma'am, I will now begin and I will raise your shirt. Let us remember also to provide some privacy to make her feel comfortable because we will be exposing the patient's abdominal area. And now I am going to proceed the first maneuver, which is called the fundal root. So I am going to face my patient and palpate the uterine fundus to establish which part of the fetal pole is at the upper portion of the uterus. So if the head is palpated, it would be feel hard and around freely movable and ballotable. And however, if the breech or buttocks is palpated, then it will feel softer and nodular. And now I'm going to proceed to the second maneuver. This is called the umbilical grip, and I'm going to palpate in a downward direction on both sides of the abdomen, applying a gentle but deep pressure. Okay ma'am, I'm going to palpate again and I try to determine your baby's back extremities and anterior shoulder. So if the fetal back is palpated, then it would be feel continuous structure. However, if the fetal back extremities is palpated, it would be feel nodular. So now I'm going to proceed to the third maneuver. It is called the Patrick's grip. I am going to use my thumb and my fingers in one hand, and the lower abdomen is grasped just above the symphysis pubis to determine if the presenting part is already engaged. So ma'am, I'm going to palpate again. So if not engaged, immovable body part will be felt. Now I'm going to proceed to the fourth maneuver. This is called the fondal grip. This is done to determine if the findings of the third maneuver is also determine of the flexion of the vertex into the pelvis. So now I'm going to face the patient feet and palpate the symphysis symbolic prominence. Now, if the prominence is in the same side of the small parts, and then the baby's head is flexed, and then however, if the prominence is of the same side as of the fetal back, then the baby is extended. So ma'am, I'll now proceed to listening your baby's heartbeat. To do this, I'll have to locate the fetal back again, and then place the stethoscope over it, and then listen for one full minute. So I was listening to the fetal heart tone. I noted its location, rate, and character for documentation afterwards. So ma'am, we are now done. Are you comfortable? So ma'am, your baby's head is in lower portion, and your baby's buttock is in upper portion of your uterus. In the baby's heartbeats is 130 beats per minute, which falls within normal range. So ma'am, we are now done, and I'm going to leave you now, and now you may take rest. And now I'm going to perform a hand hygiene, and I'm going to document the findings of the assessment.